Thank you very much. Good afternoon. I'm pleased to be joined today by Dr. Dirk Huyer, who will be providing a brief update on the progress related to the testing, particularly of farm workers. But before I turn it over to him, I am going to provide a brief overview of the trends from the last few days. For the much of the province, the trends have remained very positive. It's been over 2 weeks since many regions in Ontario have moved to Stage 2, and the number of new cases has remained steady. On Friday last week, we saw only 111 new cases, and this past weekend, Ontario recorded 160 cases on Saturday and 178 cases on Sunday. These numbers are encouraging, especially as the number of tests per day has remained well above 20,000, reaching a record 33,492 on Saturday. While these trends are encouraging, unfortunately, we have seen outbreaks related to the reopening of the province. In the Kingston region, which had only previously seen 63 cases prior to entering Stage 2, they now have 25 cases that are linked to local nail salons. This serves as an important reminder for why we are asking people and businesses to remain vigilant. As we relax public health measures, it is essential that all Ontarians continue to follow our public health advice and do their part to keep themselves and those around them safe. What we really want to see is the number of cases going down. Today, Ontario's overall new case count is the highest it's been since mid-June. However, of the 257 new cases recorded today, 177 of them are in Windsor-Essex, and they are associated with farm outbreaks. These recent outbreaks are concerning, and they pose unique challenges that require a targeted response. So we have been working with them very closely. At this point today, we have Windsor-Essex has sent a team of public health nurses and inspectors out to the farm that has the majority of the cases to re-interview them and determine whether they have symptoms and determine the best next steps in terms of controlling the outbreak. So really, we're looking at on-site testing, which Dr. Huyer will speak more about, public health guidance, and ensuring access to employment benefits and supports as the three stools to the approach. Work self-isolation is not replacing other accommodations or options if they are feasible. And it will be important, if it is applied at all, to maintain physical distancing and apply source control measures, and importantly, have daily health checks. So this would be applied depending on what's found through the investigation by the health unit and in discussion with the ministry and the employer. And at the end of the day, the employer is responsible for ensuring that other workers are not at risk. The health and well-being of every person in Ontario, including all these workers, remains our top priority. I'm now going to turn it over to Dr. Huyer for a few remarks about the testing strategy. Thank you.
Thank you, Dr. Yaffe, and good afternoon, everybody. I just want to build off what Dr. Yaffe said in a couple of areas. First and foremost, all of us need to be thinking about all steps we can take to prevent any spread of COVID-19. All of us know how serious this is. All of us know that it's very infective, and we need to follow all public health guidance, all common sense approaches of physical distancing, potentially wearing masks when you're in a situation where you can't physically distance effectively, hand washing, and being vigilant for any potential transmission. This is by far the most important thing that we can all do and work together to prevent any additional spread. One of the considerations that is undertaken within the response to potential infection with COVID-19 is testing. And as Dr. Yaffe talked about, we have been testing broadly in Ontario over the past 2 weeks. And the good news is that our numbers have not been going up. We've done substantial number of tests for people who are symptomatic or people who feel they may be at risk of the infection of COVID-19, and we have not seen our positivity rate go up. Having said, I recognize what Dr. Yaffe is talking about with the 177, and I think it's important not to focus in a negative way on the 177, but to recognize that the numbers across Ontario are significantly increased by that. That was part of an initiative that I have some involvement, but most importantly with my colleagues at OMAFRA, ministry that's dealing with agriculture and agri-food, as well as the local farmers, local operators, and local growers, and the medical officer of health, and the hospitals. This is a multifaceted, multi-group approach to trying to understand illness within the farm community in the Windsor-Essex area. And we've all been working together. Everybody has been really trying to sort through this challenge, and that has led to additional testing in a broad way across many farms in the Windsor-Essex area to ensure that we recognize and identify when there may be infections present, and then address those and ensure the health and safety of all the staff, both the owners, the operators, the farmers, those who are working on the facility, and more broadly, all of us in Ontario, to help to ensure that we address any potential issues. We have tested on many farms, both through attending at a specific assessment center that was built to respond to the farm testing, but also some on-site testing. And we did find a significant number just recently. And as Dr. Yaffe's pointed out, we're working together with the medical officer of health, who has responsibility and expertise to help to ensure that the response is most effective to be able to stop any further spread of this. I'll stop at that point.
Go to the phone lines. Just a reminder, one question, one follow-up. First question.
Your first question comes from Colin DeMello with CTV News. Please go ahead.
Hello, good afternoon. The mayors of the Greater Toronto and Hamilton area have issued a joint press release today asking on the government and, of course, the Chief Medical Officer of Health to issue a mandatory mask order for at least large urban centers that would include the Greater Toronto area and Ottawa. Is a mandatory mask order under consideration?
So, thank you for that question. I think everything is always under consideration in this situation because it's a serious situation and it's changing all the time. At this point, we are strongly recommending wearing masks in non-medical masks, face coverings, in situations where you cannot be sure that you will be able to maintain social distancing of at least 2 meters. So it's usually indoors. It may be outdoors as well. And I think that certainly we would consider every option as it goes along, depending on the evidence. If we see a lot of people are not complying, that may be it may be better to have mandatory. But at this point, we're sticking with strongly encouraging.
Follow-up.
Thank you, Dr. Yaffe. I'm wondering what the evidence shows right now in terms of the use of masks, because anecdotally, if you go out to a store, you see, a variety of compliance. Some people are wearing masks, some people are not, some people are, following the arrows, and other people are not. So it really does depend sometimes from person to person and place to place. What type of hard evidence does the province have in terms of the compliance when it comes to even the recommended use for masks? And what type of evidence do you need to see in order to issue an official order?
Well, I think that we're going to see, in terms of what the individual health units are finding, obviously one of the indicators would be the number of cases. We've seen the outbreaks from nail salons in Kingston. And in terms of what the general public is saying and what we observe, I think that one of the issues is enforcement. And in terms of also if it's a provincial order, do we need to do this everywhere at the same time, or is it something that needs to be done regionally depending on how the public is behaving? So it's something we need to keep looking at and keeping in touch with the partners in the local health units and municipalities as we move forward.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hi, doctors. I'm just wondering, with this pretty big spike in the cases down in Kingsville and Leamington over the weekend, are you going to have to rethink that policy last week about asymptomatic workers being allowed to work in their clusters? Because it's becoming, I think it's rather unclear whether these people who say they are asymptomatic actually are, and that's why the nurses and the nurse practitioners are going in there today to do individual health assessments.
I'll start, and then I'm sure Dr. Huyer wants to add. We are not applying that policy until we determine that it is the correct conditions for it. That guidance was developed, I think, in view of having a very small handful of asymptomatic positive people. We don't have a small handful in this instance. We have quite a lot of people. So we need to have the team go out there today, investigate, interview each of those people more carefully with an interpreter, which is what's happening, to determine actually do they have any of the symptoms. There are a lot of potential symptoms that people may not have remembered, or they weren't asked specifically. So I think there's a chance that a good number of them may in fact be symptomatic. We'll have to wait and see. And so that guidance around work self-isolation can only be applied if the conditions are present and if the local medical officer of health feels it is a safe thing to do. At this point, we don't have the information.
Just to build on that, first and foremost, as the guidance was released last week, the initial and the solid foundation and fundamental consideration was if there was a single or maybe two people who were determined to be asymptomatic. So it required still an evaluation by the medical officer of health. There's still required an evaluation as to whether that person was associated with, if there was two, that person was associated with somebody else within the workplace, which may illustrate or demonstrate an infection within the workplace. First and foremost, the medical officer of health must sort through and evaluate whether there is an infection in the workplace to protect everybody else in that workplace. If in fact it's one individual who through evaluation did not have symptoms, that's a different consideration from 177. And it's very complex, and Dr. Yaffe has clearly outlined the challenges and the importance of having a detailed understanding. The guidance was, as I understand, and I was involved in some of the discussions prior to it being released, was to affect some of the testing, targeted testing campaigns that are being completed right now to help to understand the role of testing as we continue to move forward in opening the economy. So in other workplaces, we have done some testing, and it's really understanding, did people have symptoms? Is this a risk situation? And clearly the decision is left to the medical officer of health based upon the information that's available. So I think that there's been an interpretation that somebody who's positive, where initially there wasn't a belief that there were symptoms, automatically would return to work. That's a consideration, and an important consideration, because if they've turned out to have a test that is positive and there isn't a belief that they're infective, then maybe they, and there is the potential for them to return to work in a careful way to ensure that there isn't any risk of spread to anybody else. So I think that it's important to fully understand the guidance that's been outlined and the care and caution that must be used, because this is different. This is different than what's been provided as the specific guidance every time somebody was suspected to have COVID, because to protect everybody, there has been very careful consideration throughout, and we need to maintain that care. This provides the opportunity for others to think about other approaches as long as it's safe for everybody.
Follow up?
Yeah, thanks for that. And I just wanted to follow up on that with the Premier saying 175 people of 450 workers at a farm has tested positive. Do you need to just close that farm down?
Well, I mean, that is one of the considerations. As we go through the investigation, we determine, for those people who are positive, again, are they symptomatic? What about their contacts? Who have they been exposing? Who have they been closely working with? Who have they been living with? And, what actually is necessary to ensure that people, that we prevent and control the spread of this infection. It's very infectious, as we've said. So one of the options is to close the farm. That has other ramifications, and it's not the automatic thing we would do, but it's one of the considerations.
Next question.
Your next question comes from Miriam Adalia with Radio Canada. Please go ahead.
Hello. My question is also about migrant workers. Can you walk us through, after this campaign of testing in Windsor-Essex, are you going to do it region by region? We heard today Doug Ford talk about Niagara. Are you going like week by week? Can you explain that a little bit more?
Yes, we are incrementally progressing across the province, and we're working to finalize plans. Niagara is likely the region that will be the opportunity for testing will occur, and then Haldimand, Norfolk, Brant County, other southwest areas are all the plans are in the development, and working with OMAFRA as well as others in the local communities to determine the most effective approach within each community. Each has its own approaches as far as the healthcare participation and the public health unit involvement. So we are working progressively to do that across the province. Yes.
Follow up.
Thank you. And my other question is about the mayors and chairs unanimously agreeing to request the government of Ontario to implement the mandatory face covering. Seems like many mayors and Doug Ford are just going back and forth on this. What can public health do, Ontario Public Health do to make this a thing?
I'm not sure what you mean by make this a thing. Do you mean like to order it?
Is there a way that you can wade in and apply that for, or help applying it?
I think it is possible for the province to order it. I think it becomes a question of how it would be enforced. And also the question is this something that's applicable in every part of the province? Are there parts where it's not necessary? So at this point, we are strongly recommending and encouraging and monitoring, and making it mandatory is a consideration if we feel it's appropriate.
Next question. This will be the last question.
Your final question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Dr. Yaffe. I'm looking at some of the stats that Toronto Public Health publishes around the turnaround time on tests, and those numbers seem to actually not be getting better. They're actually getting worse. Can you explain why so few tests are actually being reported, the results of the tests are why so few, such a low percentage of tests are being reported to Toronto Public Health within the 24-hour and 48-hour timelines that they have set out as their criteria?
Actually, Dr. Huyer is probably the best to answer that.
Hi, Mr. Crawley. Thanks for the question. These I don't have all of the specific numbers in front of me, so I'll have some challenges answering every detailed question about that. But what I can say is that we have been testing in Ontario. The number of tests that have been completed in Ontario over the past week have been significant. At one point, I think we're at 33,100. And when we do that many tests, it does affect the laboratory. The laboratory are working above capacity in many areas, and that does have an effect on completion and release of the reports, and that does have an effect on the turnaround times.
Follow up. This is the last question.
Yeah, so just to follow it up, on that, Dr. Huyer. Should we be concerned about the fact that a relatively low proportion of the test results are being reported within those timeframes?
We're actively looking at all approaches within the laboratory to try to ensure that the turnaround times are as efficient and as effective as they can be. And there's many factors that contribute to that, but it is it's a very important issue that everybody is focusing that many people are focusing their attention upon to ensure that we provide those test results in the most effective and the quickest way. So there are a number of considerations that people are working on to try to get that out, to get the test results out as quickly as possible.
Thanks, everyone.